Hello and welcome to Knowing Your Heart. This program was developed by a group of healthcare professionals that all have the passion and enthusiasm to help you take better care of yourself. Knowing Your Heart is an educational series designed to eliminate heart disease, diabetes, and the metabolic syndrome as the leading causes of death and disability in the United States. Knowing Your Heart stresses the importance of screening and risk assessment, medical management, and lifestyle modification. As you know, obesity, diabetes, and heart disease have become epidemics in the U.S. 2 out of 3 of us are overweight, and that has a direct relationship with the increase in both diabetes and heart disease. There are now 18 million Americans with diabetes, and over 60 million with the metabolic syndrome, which we know leads to diabetes. And heart disease has become the biggest killer in the history of the world. Today, 1,500 people will die of heart disease. Obesity, diabetes, and heart disease are progressive diseases, and they are interrelated. Becoming overweight leads to obesity. Elevated blood pressure, blood sugar, and cholesterol abnormalities lead to the metabolic syndrome, which can lead to both diabetes and heart disease. And the development of symptoms are a sign of heart disease and can lead to a heart attack or cardiac death. How many of you know someone that died from heart disease? If so, was it a surprise? How do we stop this from occurring? The good news is that obesity, diabetes, and heart disease are preventable conditions, and we have enormous opportunities for improvement. Some key statistics to consider. First, the sign of heart disease is death in over 50% of cases, and 2 out of 3 heart attacks occur in a blood vessel that is less than 50% blocked. Imagine the opportunity if we could detect heart disease sooner. Evidence-based guidelines are followed only 60% of the time. These are recommendations from experts that are based on overwhelming evidence that, if implemented, would reduce death and disability. Imagine the opportunity if we could get more people on the right treatment. Compliance to said treatments, for example statins, which are drugs used to lower cholesterol, have consistently shown to reduce heart attacks and death, and are complied with only 20% of the time. Imagine the opportunity if people followed their advice that their doctor gave them and complied with their treatment. Imagine the opportunity. Let's consider the opportunity here. Back in the 1960s, we began the war on poverty. Since then, we've waged war on drugs and on terrorism. We feel that it is now time to wage war on obesity, diabetes, and heart disease. While this may seem like an insurmountable task, we must have thought the same thing before we discovered penicillin, built an atomic bomb, or put a man on the moon. Unlike these earlier discoveries, however, we already have much of the know-how and technology in place. What is lacking is a system to help people take a greater role in their own health and help them stay connected to their healthcare providers. The first step is to identify the disease much earlier in its course. We cannot wait for the onset of diabetes or a heart attack. In 50% of men and 70% of women, the first sign of heart disease is death. Not a good way to find out about your condition. Many people diagnosed with diabetes have had it for many years, and in 50% of the cases already have heart disease. 2/3 of heart attacks occur in a vessel that is less than 50% blocked. Yet it takes a 70% blockage to detect heart disease on a stress test. These conditions take years and even decades to develop. The earlier we know the problem, the more effective the treatment will be. Checking includes assessing your personal and family history of diabetes and heart disease, learning about diagnostic tests such as stress tests, angiograms, and imaging, and how risk factors such as your lipid profile, blood pressure, and blood sugar, and your lifestyle such as smoking, diet, activity, and stress affect your risk. The second step is to have more effective treatments and increase compliance to these treatments. Medical mistakes are now the 3rd leading cause of death, and only 55% of us are on the proper treatment. Those patients that are on the right treatment have good reason for hope. Clinical trials in lipid management, heart failure management, and diabetes have shown significant improvements in medical conditions, fewer heart-related events, and death. If you are going to be a subject in any of these studies, we encourage you to be in the treatment arm, not the control. Healing includes learning about procedures such as coronary artery bypass surgery, coronary stenting, and devices. It also includes learning about treatment guidelines for lipids, blood pressure, and diabetes, and we take a look at common medications. The third and final step is to employ lifestyle modification. With all the advancements in medical technology, why should we even bother with lifestyle factors? It is a busy world out there, and it is a lot easier to have a procedure or take a pill than to make lifestyle changes. The medical industrial establishment does really not have a dog in this hunt, so you won't hear much about it. But the Lifestyle Heart Trial, the Mediterranean Diet, and the Diabetes Prevention Trial are some examples where lifestyle modification not only did as well, but actually outperformed medical management arms.